Robert was 72 years old, standing in his kitchen making a sandwich when his left hand stopped working. Just stopped. The knife clattered to the counter. He tried to pick it up again, and his hand would not respond. His arm felt heavy, like it belonged to someone else. And then his face started drooping on the left side. Robert knew exactly what was happening. He was having a stroke. He was alone. His wife was at her book club. His phone was across the room on the charger. And in that moment, Robert did something that neurologists say saved his brain, something so simple that it sounds almost too easy to matter. But it does matter. And what he did in those 3 minutes before his wife came home and called 911 is the difference between Robert walking out of the hospital 5 days later and Robert spending the rest of his life in a wheelchair. I am Dr. Lauren Hayes. I have spent years studying the physiological responses that occur during critical neurological events, including stroke, and how the body responds in those first terrifying minutes before professional medical help arrives. I have reviewed what happens when people do the right things immediately, and I have seen what happens when they do not. Today, I am going to teach you the exact 3-minute technique that can limit stroke damage before the ambulance even arrives, because every second matters during a stroke. Brain cells are dying, thousands of them, every minute, and what you do in those first critical minutes can determine whether you recover fully or lose function permanently. But before I tell you what Robert did, you need to understand what is actually happening inside your brain during a stroke. Because once you understand the mechanics, the technique will make complete sense. A stroke is a blocked artery in your brain, usually a blood clot. It lodges in one of the vessels supplying oxygen to your brain tissue. And the moment that vessel is blocked, the brain cells downstream from that blockage stop receiving oxygen. Without oxygen, brain cells start dying within minutes, not hours, minutes. Here is the terrifying reality. In a typical stroke, nearly 2 million brain cells die every single minute the blockage remains. 2 million per minute. After just 3 minutes, you have lost 6 million neurons. After 10 minutes, 20 million. These cells control movement, speech, memory, and sensation. And once they are gone, they do not regenerate. The damage is permanent. But here is what most people never learn. During a stroke, there are two distinct zones of damage. There is the core, where blood flow is completely cut off and cells die immediately. And then there is the penumbra, the surrounding area where blood flow is severely reduced but not completely stopped. Cells in the penumbra are struggling. They are oxygen-starved. They are on the absolute edge of death, but they are not dead yet. And this is precisely where the 3-minute technique becomes critical. Because if you can increase blood flow to that penumbra, even slightly, even temporarily, you can keep those struggling cells alive long enough for medical help to arrive. You can reduce the total damage. You can mean the difference between losing your ability to speak and keeping it, between paralysis and recovery. Now you are probably wondering what Robert did standing in that kitchen with a useless arm and a drooping face. And I am going to tell you. But first you need to know the one thing most people do wrong that makes stroke damage significantly worse. When most people realize they are having a stroke, panic sets in immediately. Heart rate skyrockets. Breathing becomes rapid and shallow. Blood pressure spikes from the acute stress response. And ironically, this panic makes the stroke measurably worse. Here's the physiological reason. When you panic, your body enters fight or flight mode. Blood gets redirected away from your brain and toward your muscles. Your blood pressure becomes erratic and unpredictable. The oxygen that is still reaching your brain gets consumed faster because your heart and lungs are working at maximum capacity. You are literally starving your brain of the oxygen it desperately needs during the most critical minutes of your life. And there is something else that makes this worse. Many stroke patients, in their panic attempt to get up and move, they try to reach the phone, get to the door, find help somehow. And that physical exertion drains oxygen even faster. I have reviewed cases of patients who tried to walk to a neighboring room during a stroke and collapsed before they got there. The exertion accelerated the neurological damage dramatically. So the first element of this technique is deeply counterintuitive. You need to calm down. Not because staying calm will somehow reverse the stroke, but because panic makes every aspect of the situation measurably worse. And there is a specific method to force your body into a calmer physiological state, even when everything inside you is screaming that you are in danger. But calming down is only step one. There is something else you need to do with your body position that almost nobody instinctively considers. And this is exactly what Robert did that saved him. Robert felt his arm go limp and his face begin drooping. And instead of panicking, instead of trying to get to his phone across the room, he did 3 specific things in careful order. I am going to walk you through exactly what he did and precisely why each step works. Step 1. He sat down immediately, not in a chair, on the floor. He lowered himself to the kitchen floor as slowly and controlled as he could manage and sat with his back against the cabinet. Why does this matter so critically? Because sitting or lying down immediately eliminates the physical exertion that has been draining oxygen from your brain. Your brain no longer has to compete with your leg muscles for available blood flow. And critically, lowering your head closer to the level of your heart makes it meaningfully easier for blood to reach your brain against the force of gravity. When you are standing during a stroke, your heart must pump blood upward to your brain. That is demanding physiological work, especially when blood pressure is already unstable from the stroke itself. But when you are sitting or lying down, the heart does not have to fight gravity as forcefully. Blood flow to the brain improves, not dramatically. But even a modest improvement matters enormously when brain cells are dying by the millions every minute. Robert sat down. That was step 1. Step 2. He controlled his breathing. This is the element that sounds far too simple to make any real difference, but the science supporting it is completely solid. Robert began breathing slowly and deliberately. In through his nose for 4 counts, hold for 2, out through his mouth for 6 counts. Slow, controlled, intentional breathing. Here is precisely why this matters. When you are having a stroke, your natural instinct is to hyperventilate, rapid, shallow breaths driven by panic and fear. But hyperventilation actually reduces blood flow to your brain. When you breathe too rapidly, you exhale too much carbon dioxide. Your blood vessels constrict in direct physiological response. Less blood reaches your brain. You are actively making the oxygen shortage worse in a moment when your brain can least afford it. Slow, deep breathing does the exact opposite. It maintains carbon dioxide at normal levels. Blood vessels remain dilated and open. Blood flow to the brain is optimized within the constraints of the emergency. And critically, slow, controlled breathing directly activates your parasympathetic nervous system, the neurological system responsible for calming the body. Heart rate stabilizes, blood pressure moderates, your body stops consuming oxygen in a state of acute panic. Robert sat on the kitchen floor, breathing slowly for 2 full minutes. Just breathing. And while he did that, his brain was receiving slightly more oxygen than it would have received if he had been standing and hyperventilating in panic. Those struggling cells in the penumbra were staying alive a little longer, buying time. But he did one more thing, and this is the step that neurologists specifically recommend, but that almost nobody outside the medical community knows about. Step 3. He turned his head toward the affected side. Robert's left side was weak, so he gently turned his head to the left and tilted it slightly downward. Why would this help? Because blood flow to your brain is not perfectly symmetrical between the 2 sides. When you turn your head toward one side, the carotid artery on that side opens slightly. The vertebral arteries that run upward through your neck are also influenced by head position. By turning his head toward his affected left side, Robert was attempting to maximize blood flow to the precise area of his brain that the stroke was damaging. Is this a cure? Absolutely not. Will this reverse the stroke? No. But will it potentially preserve thousands of additional brain cells by optimizing blood flow during those critical minutes before help arrives? Yes. And those preserved cells might represent the difference between needing months of speech therapy and speaking normally, between a wheelchair and walking independently. Robert sat on the kitchen floor, breathing slowly with his head gently turned to the left for 3 minutes, until his wife came home and found him. She called 911 without hesitation. The paramedics arrived within 8 minutes. Robert received clot-busting medication within the critical treatment window, and he walked out of the hospital 5 days later with minimal lasting deficits. Would he have recovered anyway? Perhaps. But the physiology is clear. What he did gave him meaningfully better odds. And when brain cells are dying by the millions every minute, better odds matter more than most people realize. Now let me tell you what else you must do the moment you recognize you are having a stroke. If you are alone, you need to reach a phone. But here's the detail that changes everything. Do not stand up and walk across the room. If you must move, crawl. Stay as low as possible. Minimize every ounce of physical exertion. Every step you take upright is oxygen. Your brain is not receiving. If you can reach a phone from where you already are, use it from that position. If you genuinely cannot and must move, Crawl toward it while maintaining as much calm as you can manage. When you connect with emergency services, say 4 specific words immediately and clearly. I am having a stroke, not I think something might be wrong, not my arm feels strange and my face feels odd. Say directly and without hesitation, I am having a stroke. These 4 words trigger the absolute highest priority emergency response. The dispatcher immediately recognizes this as a time-critical neurological emergency. You will receive an ambulance faster than if your symptoms are described vaguely or uncertainly. Then give your address. If speech is impaired because of the stroke, stay on the line regardless. Emergency dispatchers can trace call locations, but getting those words out, I am having a stroke, and your complete address, those are the 2 most critical pieces of information in the first moments of this emergency. And if you are present with someone who is having a stroke, do not allow them to talk you out of calling 911. I have reviewed cases where patients clearly recognized they were having a stroke but did not want to be a burden to anyone. They waited. They hoped it would pass on its own. And by the time they finally arrived at the hospital, the treatment window had permanently closed. The damage was irreversible. A stroke is a medical emergency, never a situation where waiting and observing is appropriate. Call immediately, without negotiation. Let me explain the treatment window, because truly understanding this reveals why every single minute matters so profoundly. When you arrive at the hospital during an active stroke, you go directly to a CT scan. Physicians need to visualize your brain immediately to determine the type of stroke occurring. Is it ischemic, caused by a blocked blood vessel, or hemorrhagic, caused by active bleeding in the brain? The treatment approach is fundamentally different for each type. If it is ischemic, which accounts for approximately 87% of all strokes, and you are within the treatment window, you receive a medication called TPA, tissue plasminogen activator. This medication dissolves the clot that is blocking your brain's blood supply. It is extraordinarily effective when administered in time. But here is the limitation that makes timing everything. It must be administered within 4.5 hours of stroke onset, and preferably within 3 hours. After that window closes, the medication becomes too dangerous because the risk of causing bleeding in the brain outweighs the potential benefits of dissolving the clot. And even within that window, sooner is always meaningfully better. Data from the American Stroke Association demonstrates that for every 15-minute delay in treatment stroke, patients lose an average of 1 full month of disability-free life. 15 minutes equals 1 month. That is the precision with which time matters in this emergency. So when you use the 3-minute technique, sitting down, controlled breathing, optimal head positioning, you are not simply preserving brain cells in isolation. You are keeping yourself stable enough to remain conscious, to communicate with emergency services, to provide paramedics with accurate information when they arrive. You are buying critical time for the treatment that can actually reverse stroke damage. There is something you need to understand specifically about stroke risk after 60. And it is information that could help you prevent a stroke from occurring in the first place. Your risk of stroke doubles every decade after age 55. By the time you reach 75, your stroke risk is 8 times higher than it was at 50. Why? Because your blood vessels age alongside everything else. They become stiffer and less flexible over time. Plaque accumulates gradually on vessel walls, progressively narrowing them. Blood pressure tends to increase with age, placing additional chronic stress on these aging vessels. And conditions like atrial fibrillation, an irregular heartbeat that generates blood clots, become substantially more prevalent after 60. If you have high blood pressure, atrial fibrillation, diabetes, or if you smoke, your risk is elevated significantly beyond the baseline. And here is what concerns me most about these statistics. Many strokes are genuinely preventable. Blood pressure medication works, blood thinners prescribed for atrial fibrillation work, controlling blood sugar works consistently, but people do not take their medications consistently. They skip doses. They discontinue treatment because they feel perfectly well. Feeling well does not mean you are physiologically safe. High blood pressure produces no pain or discomfort. Atrial fibrillation frequently generates no symptoms whatsoever. Diabetes can remain clinically silent for years before it announces itself dramatically. You feel completely fine right up until the moment the stroke happens, and then fine is simply over. If your physician prescribed blood pressure medication, take it every single day without exception. If you are prescribed a blood thinner, take it exactly as directed every time. These medications are preventing the stroke you have no awareness is approaching. A daily pill taken faithfully for 30 years is infinitely preferable to a single day unable to speak or move or recognize the faces of people you love. Let me describe what happens in the minutes and hours after you arrive at the hospital, because understanding this sequence makes absolutely clear why the 3-minute technique matters so much. If the CT scan confirms an ischemic stroke and you are within the treatment window, TPA goes directly into your IV. Within minutes, it begins dissolving the clot. Blood flow is restored. Brain cells that were starving for oxygen begin recovering. But not all of them. The cells that died in the core zone are permanently gone. However, the cells in the penumbra, those struggling cells that were barely surviving at the edge, many of those can recover meaningfully if blood flow is restored quickly enough. This is precisely why what you did in those first minutes outside the hospital matters so critically. The more penumbra cells you preserved through the 3-minute technique, the better your potential recovery trajectory. After TPA administration, you are monitored carefully because the medication that dissolves clots can also cause bleeding if the situation is not managed with precision. But when it works, and it works most of the time when administered early, the results can be genuinely remarkable. Some women and men who arrive at the hospital completely unable to move an arm leave 1 week later with full functional restoration. Not every patient. Stroke recovery varies considerably depending on multiple factors. But early treatment gives you the best possible chance at the best possible outcome. Let me address something important. What if you wake up with stroke symptoms and genuinely do not know when the stroke began? Approximately 25% of strokes occur during sleep. You go to bed feeling completely well and wake up with weakness, slurred speech, or facial drooping. These are called wake-up strokes, and they create a clinical challenge because the precise onset time is unknown. You may potentially be outside the standard treatment window, but there is important information here. Advanced MRI imaging technology can sometimes determine whether brain tissue remains salvageable even without knowing the exact moment the stroke began. Some wake-up stroke patients remain eligible for clot-dissolving treatment based on these sophisticated imaging findings alone. So even if you wake up with stroke symptoms and have no idea when they started, call 911 immediately without delay. Do not assume the treatment window has already closed. Let the hospital make that clinical determination with proper imaging technology. And while you wait for help to arrive, use the 3-minute technique. Lie down, control your breathing deliberately, position your head gently toward the affected side. Give your brain every physiological advantage available to you. I want to discuss something critically important, something that is difficult to fully absorb, but that could genuinely save your life. What are the warning signs that a stroke may be approaching? Some strokes arrive without any warning whatsoever, but many, perhaps most, provide warning signals in the hours or even days before the main event. These are called transient ischemic attacks, TIAs, sometimes called ministrokes. The symptoms are identical to a full stroke: weakness, facial drooping, speech difficulty, vision disturbances, but they resolve completely within minutes to hours on their own. A TIA is your brain's emergency alarm system. It is telling you directly that blood flow to part of your brain was temporarily blocked. The blockage cleared spontaneously this time, but it is a serious warning that a full stroke may be imminent. Statistics show that after a TIA, your risk of experiencing a major stroke within 90 days is approximately 17%, nearly 1 in 5 people. If you experience stroke-like symptoms that then resolve completely, you do not feel relieved and return to your day. You call 911 or go directly to an emergency room immediately. A TIA is a medical emergency requiring urgent evaluation and intervention. Treatment following a TIA can prevent the major stroke that the data suggests may be coming. And here is what makes this outcome so preventable and yet so common. I have reviewed cases of stroke patients who described clear warning symptoms days before their devastating event. Their arm went numb for 10 minutes and returned to normal. They experienced brief, slurred speech that resolved completely. They did nothing because the symptoms disappeared and they felt fine again. And then the full stroke arrived, and this time it did not resolve. Do not be that person. Know the warning signs clearly. Face drooping, arm weakness, speech difficulty, vision changes, sudden severe headache unlike anything previous, dizziness, and loss of balance. If you experience any of these, particularly if you are over 60, seek medical attention immediately, even if every single symptom has resolved completely by the time you consider calling. Let me be absolutely clear about something important. The 3-minute technique is not a treatment for stroke. It is a method of preserving brain tissue and maintaining physiological stability while you wait for real emergency medical intervention. You still need 911, you still need the hospital, you still need clot-busting medication or whatever intervention the treating physicians determine is appropriate for your specific situation. But in those critical minutes before the ambulance arrives, you have genuine, meaningful control over what happens to your brain. You can sit down, you can control your breathing deliberately, you can position yourself to optimize blood flow. These simple, accessible actions can preserve brain function that would otherwise be permanently lost while you wait. Here is what I want you to do right now, not later, right now as you are watching this. Think carefully about where you spend most of your time throughout the day: your kitchen, your living room, your bedroom. Where is the nearest place you could safely and quickly sit or lower yourself to the floor if stroke symptoms suddenly appeared? Where is your phone right now? Can you reach it from that position without standing and walking across the room? If you live alone, keep your phone on your person throughout the day, in your pocket or clipped to your clothing, not charging across the room, because if you cannot reach the phone in the first minute of a stroke, the 3-minute technique loses much of its value. The ability to call for help is the foundation that everything else depends on. Talk to your family. Make sure the people who share your home or spend significant time with you know the stroke warning signs clearly. Make sure they understand to call 911 immediately, not to wait and see whether symptoms improve on their own. Make sure they understand not to allow you to talk them out of calling for help, even if you insist you are fine. I have reviewed too many cases where a husband or wife had unmistakable stroke symptoms and their partner waited because the patient insisted they were simply overtired, because they did not want to overreact, because they were embarrassed about causing a fuss. By the time they arrived at the hospital, the treatment window had permanently and irreversibly closed. Do not allow pride or the fear of overreacting to stand between you and life-saving emergency treatment. If you have risk factors, high blood pressure, atrial fibrillation, diabetes, take them seriously every single day without exception. Take your medications consistently. See your physician regularly. Have your blood pressure checked and recorded. These routine, unremarkable daily habits are what prevent the catastrophic emergency that changes everything in an instant. Robert, the man whose story opened this video, takes his blood pressure medication faithfully every single day now. He did not before the stroke. He felt completely fine and genuinely believed he did not need it. Now he understands clearly what that assumption nearly cost him. And he is fortunate beyond measure to have received a second opportunity to learn that lesson. Not everyone receives a second opportunity. Approximately 1 in 6 stroke patients dies. Many more are left with permanent disabilities that reshape every aspect of their remaining life. Some cannot speak. Some cannot walk. Some cannot care for themselves or recognize the people they love. And for many of them, the outcome could have been genuinely different if they had acted faster, if they had known what to do in those first critical minutes when so much was still salvageable. You now know what to do. Sit down immediately. Control your breathing deliberately and slowly. Position your head gently toward the affected side, and get help as fast as humanly possible. These are not complicated steps requiring special training or equipment. They require only the knowledge you now have and the presence of mind to use it in the moment that matters most. I am Dr. Lauren Hayes. Please share this video with someone over 60 in your life who deserves to have this information before they ever need it, because you genuinely never know whose brain this knowledge will protect until the moment it does. Take care of yourselves, and I will see you in the next video.